there's been some long-standing questions about whether Erdheim-Chester disease qualifies as a cancer or not. One of the discoveries that, in my mind, added a lot of clarity to that question was the discovery of the BRAF mutation in about 50 to 60% of patients with Erdheim-Chester disease. The BRAF mutation is a mutation that we see in a number of different cancers. In the mind of myself and a lot of other physicians in the area, that really helped reclassify this as a cancer over autoimmune disease.
This is a cancer-causing mutation that occurs in other cancers, other tumors, most predominantly melanoma, and patients with the disease whose tumor has this mutation are eligible for the trial that we have.
We have now even multi-centric trial with a drug which blocks the activity of a protein which is called BRAF. There's a trial which is opened in multiple centers, including us and including Memorial Sloan-Kettering Cancer Center.
The goal of the trial is not only to establish the fact that the drug works, but also, I would think, to ultimately get approval for a drug to be prescribed for Erdheim-Chester, and this is unprecedented.
And so far, it's very clear that the drug really has true efficacy in this disease, and the patients that have been treated on this will tell you that firsthand.
In learning more about the disease, we were able to do a partnership with the National Cancer Institute, and we were able to move from the natural history protocol phase to a treatment phase. And now we have a phase 2 trial where we're testing the safety and efficacy of 2 drugs that are inhibiting the pathway that is affected in this condition.
I'm actually more optimistic about this clinical trial than I've been about any clinical trial. For one thing, it's run in an incredibly rigorous fashion. It really has 2 drugs involved, one that addresses the BRAF itself and the other that addresses a problem downstream.
When you get a tissue biopsy, which often is obtained from the bone, the quality of the material is not good enough to do all these important studies to find out what is the molecular makeup of the Erdheim-Chester disease in that specific patient.
Erdheim-Chester patients need to be followed very closely because there can be symptoms, problems that come up frequently and come up over time, and someone has to be able to recognize whether they are the result of the disease, the result of treatment, the result of other medical problems.
In the urine, when the cells die, let's say, in the body, the DNA goes either to the bloodstream and then gets filtrated to the kidney, and you can collect that urine and check for the mutation. It also is a tool that will help the patients who are being treated with BRAF inhibitor therapy to see if the treatment is working.
In the study that we did in collaboration with MD Anderson, we showed that the amount of the BRAF mutation in the urine changes in reflection with how effectively you're treating this disease. The advantage of the urine testing is that it's a non-invasive test, and it seems to have excellent ability to detect the BRAF mutation. So I think it's a technology that's particularly valuable to this patient population.
It is so unbelievable that we're now at the stage that they're actually talking about treating the disease rather than just treating the symptoms of the disease.